Currently, there's close to 1 million refugees in the camps inside Bazar. They are very close to each other. There are about 40,000 people in square kilometer. So that's about 4 times that of the New York City. In a camp, it's so difficult to make sure the living conditions are good, especially during the upcoming monsoon season with the rains and strong winds and landslides happening. There are so many things which can go wrong normally, and in a pandemic situation like COVID, we were really worried about those aspects. As I speak, there are 78 cases in the Rohingya camps, which is a very small number if you compare the number of positive cases in the rest of Bangladesh. So the reason why it is small because of the steps taken collectively by the government and agencies like us. When the first case came, all the people who were in contact with that person were identified and put in quarantine.
মানে 3 ফুট দূরে দূরে তা হইবা জানলা জম বিয়ারাম নই বললা জীবানি কি ফুকবারি ফুকিবা দাসে দেখানো যা মুকম মাঝে হাত দাসে মুকত সগত নাকম মাঝে নদিউম উদ্যাহানা নাহাইম পরিষ্কার হানা হাইম নিজে পরিষ্কার তাইকুম পরিবার কলরে পরিষ্কার আইকুম.
But health workers were not taken seriously. There was misinformation going around that if you are true to God, nothing will happen to us. So it took a lot of hard work to reach out to the community leaders where doctors explained how it is causing devastation across the world. That took a lot of time and convincing, and people started taking things seriously. All our programs, from WASH program, SRH program, our other outreach programs on prevention of gender-based violence, were all aligned with the COVID response. So we provided water facilities as before. We made sure that toilets were maintained and they were cleaned on time. Hand washing points which were installed in front of every other house. Another wash facility which was introduced in the camp was hands-free, so people could use their feet like a pedal pump which could dispense soap and water, but made sure that people followed the protocol of physical distancing. We made sure that people had continuous access to critical health services.
কিন্তু কোভিড-19 আসার পরে আমাদের কাজের কিছু পরিবর্তন হয়েছে. ক্যাম্পে আসার পরে পার্সোনাল প্রোটেকশন ইউজ করি, পিপিই, গ্লাভস, মাস্ক, হ্যান্ড স্যানিটাইজার, গগলস. তারপরে আমরা ব্লকে চলে যাই রোগীদের সেবা দেওয়ার জন্য. প্রথমে আমরা রোগীদেরকে থার্মো স্ক্যানার দিয়ে টেম্পারেচার চেক করি, তারপরে হাত ধোয়ানোর পরে রোগীকে সেবা নেওয়ার জন্য পাঠানো হয়.
The nature of the work which we do in the GBV area involves large gatherings of women in certain groups of girls, adolescent girls. Those are the things which have been impacted. Large group activities have reduced as individual meetings and discussions are happening. Despite in a camp where there is 1 million people with ideal condition for the spread of the disease, despite that we had 78 cases till date, which is proof enough all that is humanly possible has been done. It's very difficult for things to go wrong after you take all the steps you have taken. So I would say it's a great success.